AYOBAMI. Kindly follow us on all our social media platforms on Instagram, Facebook, and catch us live on YouTube. Make sure you get your TSTV decoder, channel 102 on TSTV Africa. Compliments of the season. And it's good to see you on the program once again. Well, let's get straight to some of those developing stories today. Don't forget, the program is basically designed to look deep into issues that affect Nigeria as a country and Nigerians as citizens. That's what we'll be doing on the program. But that's a breaking news. Just now, it's been reported that a bomb explosion has killed 3 persons in Kogi ahead of President Muhammadu Buhari's visit. President Muhammadu Buhari is expected, has been due to visit Kogi State today, Thursday, and a report by the media this morning says that there is a bomb blast around Okene local government area of the state. This is coming through a few hours to the arrival of President Muhammadu Buhari, who is expected to commission some projects in the north central state of our country, Nigeria. Well, away from that, let's get straight to some of other developing stories. And the indication shows that the National Assembly passes 21.8 trillion 2023 budget for this administration. The National Assembly has passed the 2023 appropriation bill at 21.83 trillion naira, and this shows an increase of 1.3 trillion naira from the 20.51 trillion budget proposed by President Muhammadu Buhari. A breakdown also indicates that the budget has accommodated some allocations of 967.5 billion naira for some other transactions, 6.6 trillion naira for debt servicing, 8.3 trillion naira for the current expenditure, and 5.9 trillion naira for capital expenditure, among others. Away from that, the Labour Party is having a thumbs up from the former president, Olusoji Obasanjo. President Olusoji Obasanjo has fully backed the Obi campaign committee, which has already appointed a new DG, Oshuntokun Akin Oshuntokun, the newly appointed Director General of the Presidential Campaign Committee, PCC, of the Labour Party. Yesterday said that former President Olusegun Obasanjo is in full support of Peter Obi's presidential ambition, and he will do all his best to see how he can also bring that to achievement. Well, away from that, the police has also said that a full investigation is ongoing as regards the killing of Bolanle Rahim. Bolanle Rahim was killed on Christmas Day in Aja, Lagos. The Commissioner of Police of Lagos State has also said that the suspect, the police in charge that who pulled the trigger to kill Bolanle Rahim, is already facing some investigative measures. The IG, the Inspector General of Police, has said that commit any offense and pay dearly for it. That is what the Nigerian police has also come out to say as they warn the police officers. All right, we'll go for a short break. When we return, we'll be looking at the health sector. Now, this sector is one of those sectors that the federal government has tried as much as possible to focus, do what they can in their capacity to see how to boost it well. But how far has this sector benefited? Just to let you know, 2022 budget for the Nigerian health sector, it's about 9 billion was allocated for the health sector in 2022, and in 2021 we had a budget allocated at about 547 billion naira allocated for such sector. Now, for many other indications, this sector has suffered immensely in this administration. We'll look at that sector as we gear and prepare towards the 2023 general elections. What are the parties or the presidential campaign, candidates telling us at this point in time? This will be our focus. After the break, stay with us, please.
Tell you for a fact that this election is between. They sold form recently for 100 million. There's no meaningful development that can happen
without peace, without us being united. Arrest all unregistered vehicles.
I think we have shown the depth and breadth of talent in our Conservative Party.
Because you want to prevent a situation whereby that powdering substance will be flushed immediately.
Well, thank you so much for still staying with us. Indeed, we expect that a lot of things will happen in 2023. And don't forget that the program is strictly designed to look deep into issues that affect Nigeria and Nigerians. And that is why we're here. My name is AYOBAMI ADEYEMO. Well, to look at the health sector, and especially as we prepare for the general elections, COP 2023, I have the National Publicity Secretary, Association of Medical Laboratory Scientists of Nigeria, personal pharmacist, Olusoji Billyrose. Thank you so much for joining us on the program.
Yeah,
I should Mr. Olusoji, right?
Yes,
Billyrose.
yes.
Thank you so much for joining us on the program.
Thank you.
Well, it's been a long time.
Yeah.
Happy compliments of the season.
To you, good morning, Nigerians.
Good to see you again.
Yeah,
well,
thank
let's kick off from the news of the National Assembly passing the budget for the 2023. The budget has indicated 21.53 billion for the year 2023. Now, we still have a lot to capture in 2022. In fact, there are still some passage that have been budget that they also passed to accomplish most of the projects that this government has embarked upon for the year 2022. A lot of things, but health sector, it seems as if the focus on that sector is not is not what we expect. Most people are saying that this is one sector that Nigerians should basically focus on, especially knowing fully well that our president is always out, on medical trips here and there. Let's kick it from there. How do you react to the passage?
Yeah, so I want to say that we hope that the passage of this year's appropriation bill will not be a jamboree. I said jamboree because when you look at the budget performance, the annual budget performance, what is being posted is usually different from what is on ground. There's usually a huge disconnect between the budget as passed and then when you do a monitoring and evaluation of the performance of that budget vis-a-vis what the experiences of Nigeria, what is on ground. Okay, you find a huge disconnect, as it were. So what I think is key is that the National Assembly itself must, put into active mechanism the process of oversight function on MDAs, ministry, departments, and agencies of government. Is very, very important, so that the budget as proposed and passed, okay, we can see the implementation, the extent of implementation, and how far Nigerians have been impacted. Every year we hear trillions of naira being passed. This year is 20.8 trillion. That is huge and humongous. But whether or not we're able to translate these figures into everyday life of Nigerians, okay, in improving health outcomes, for example, in the health sector, improving life expectancy, programs and activities that will be able to impact on the healthcare delivery system is very, very important. The Abuja Declaration pegged a minimum of 15% allocation for health sector, budgetary allocation to the health sector. But you hardly find this being implemented. I think the highest we've had under this regime was, I think, 6% or so. Okay, I stand to be correct. Around 6% or thereabouts.
Figure.
Yes, figure. So we have not been able to have something above 7, you know, as it were. So a lot of emphasis need to be put on the health sector.
Well, experts have said that this year, this 2023 is expected to, have a huge increase in the health sector. In fact, some experts said that there's a huge amount on paper where there's also a light expectation coming from that sector. I will let you know that with the increase that the health sector is going to get in 2023 budget, the health sector is still capturing 5.75% of the total budget in our country, Nigeria. Do you think that's a good one?
No, for a population of over 200 million people, you must take cognizance of the health burden that Nigerians are currently going through. We have very weak infrastructure as a nation. We have presently grappling with a whole lot of Nigerians who are, going outside the country, who are leaving the country. We need to be able to bridge that manpower gap that we're losing. There's need for a lot of training. Okay, we're also grappling, like I mentioned, with decayed or weak infrastructure system. All right, and then apart from that, you look at the implementation of the universal health coverage. It's still abysmal. The primary healthcare system is weak. It's weak. In fact, most of the healthcare system, I don't know how to describe them, but you go to those places, you cannot find medicines, you cannot find professionals, as it were, that are manning those centers, that will be able to deliver on basic health care for the citizen. So when you're looking at the burden, take for instance 774 local government, you have health centers in those places. Then wards, you have health centers. How have they been able to, perform, and how have they been able to be managed over the years? So these are concerns that I think the government should be looking at. It is huge, because until we decentralize healthcare system, okay, we're going to be having a lot of the center, that's the tertiary hospitals, being overburdened with ailments that you expected that the normal primary healthcare centers will be able to handle. So there is a whole lot of work. There are no infrastructure at the primary healthcare center, at the secondary healthcare center. Nigeria needs to modernize its healthcare practice by bringing in automation and modern
day facilities.
Yes, facilities, and platforms for us to be able to provide 21st century healthcare practice, and then for us also to be able to compete with the world. The world is moving at a faster pace, and we're just foot dragging. If we're going to do all of that and become, like I always say, globally competitive, okay, compete with not even the highly industrialized nations, with emerging nations, okay, we need to up our game. We need to invest massively in infrastructure, okay, we need to invest massively in instrumentation to be able to bring the laboratories, the theaters, as it were, to standard. You understand? So these are things that requires a lot of funding. So, and then there are a lot of programs for vaccination. There are a lot of emergency responses that could come up. There are other ones that have almost become systemic with Nigeria. Diseases like Lassa fever. We have them almost year in, year out. Okay, there may be other emergencies. COVID is still there. It's still ravaging China. Okay, and currently you have the United Nations and some of those developed countries issuing more stricter visa entry, for people coming from China and the rest. So we need to invest a lot of resources in emergency response system for the nation, so that we're not caught unawares. At least COVID have taught us a lot of lessons. Okay, so many lessons have been learned from COVID, and as a nation we cannot afford to be caught unprepared again. So there is a huge, expectation, okay, and as well huge deficit, health deficit in the country that is requiring a lot of attention, which every well-meaning government must work very, very, very hard
to address it. Well, we're looking at the deficit, we're looking at expectations, and we're looking at a way to solve these challenges that is facing the health sector indeed. But let's take it a step at a time. There's something called the brain drain now. Nigeria needs, according to reports, Nigeria needs over 363 doctors. Just talking about your sister professionals now. They need over 360 doctors to address or to maintain and sustain the health sector. We just have only 24,000 doctors. What's the implication of this?
Yes, a lot. At the end of the day, what you have is that the little clinicians that are available, or the healthcare providers, of course, will be overstretched. And it is not only doctors that are...
Just to pick one out of...
Yes, I understand. Brain drain. You have nurses. And one department or one healthcare provider that is not being closely watched is a medical laboratory scientist. The rate at which they are migrating,
the medical laboratory scientist
is huge. Is huge, to say the least. Almost everybody I have around me has literally moved, So our nature does not have a vacuum. We're not doing enough to be able to replace and retrain, both for doctors, both for medical lab scientists, for pharmacists and radiographers as well. Everybody is moving, moving on to greener pastures. We're not doing enough to be able to close this gap that is being created by their exit. So what you are likely to have is that in the future, you might have a pandemic of quackery, okay? Because if you're not doing something, people become creative. People want to fill the gaps, okay, with whatever available hands, because service have to be delivered all the same, okay? So this is something that the government and the Ministry of Health must take very seriously, how to address the issue of brain drain. It is huge. The implication and the impact, honestly, is just waiting to happen upon us, because that will definitely come. You can't have this huge number of medical doctors, medical laboratory scientists, pharmacists and radiographers exiting, and nobody cares. Okay, these are highly skilled manpower. A lot of investment have gone into their education program. They are not people you can just pick and replace immediately. You understand? You can't just pick a medical doctor and replace. You can't pick a medical laboratory scientist and just replace overnight.
It's a profession that
needs a profession
expert.
Long years of training is involved in their education and for them to be able to master skills and dexterity in their various fields. So we need to be more deliberate about policies that will address brain drain, because if we don't do that, honestly, we're going to have, like I said, a pandemic in our hands in the future, as it were, that we will not be able to contend with.
Will you suggest that probably this sector probably needs, a state of emergency, probably must be declared to address this issue? What's your take on that?
Very well. We've said this over and over again. We need to declare a state of emergency on the health sector. And this is not just saying it for the purposes of saying it. We are lucky that we don't have tumults of pandemic. The country does not go through like we have in Asia. Okay, maybe that is just what has been the saving grace. But I tell you, if you look at the healthcare indices, maternal mortality indices, child mortality indices for the nation, sanitation and hygiene indices for the nation, they are all
worrisome. Very worrisome.
Lately we are having a research in polio. Okay, polio is coming back, and this is a nation that has been declared polio free. Okay, all right. So we definitely need to look at all these issues very carefully and very deliberately. Otherwise, we are going to have to be contending with so many issues, as the days goes by. So these are things that are requiring government attention for me, and I think that there is so much that we can do. If we look at the budget allocation, I don't think the country, understands the implication of the kind of allocation they give to the health sector.
The sector.
You understand? Because this is something that will not go around. It's just like just saying, just take this, whatever you can do with it, go and get creative.
You think they don't understand, or probably there's no real power to actually put enough of resources right there? We all know that most of these politicians do travel out of the country for health trip and of course health attention. So is it that they abandon Nigerians' health sector for for their own pockets, or probably they just feel we don't deserve the best?
It's priority. The government sometimes have their own priority, and the policy direction that they feel is going to
benefit
immediate gain for them. But you see, health is wealth. A healthy nation is a productive nation. Okay, a healthy nation is a wealthy nation. You must ensure that your workforce, your citizenry, are healthy for them to be able to be talking about production and whatever you want.
Productivity.
For the nation. So all these things have to put in perspective. So it depends on the priority of the nation. That is very, very important. The priority of the nation. Then number two, sometimes they're looking at maybe public sector engagement to fill the gap. But the private sector engagement to fill the gap. But if you look at the private sector, it has not been strengthened enough. We don't have like intervention funds in the private sector.
So funding is one of the big challenges that
private
sector is having.
Very, very big challenge. You look at the aviation sector, a lot of fund for aviation.
Even entertainment, a lot of funds.
Entertainment, a lot. But you don't get such funds made available for the private sector, as it were, for people to be able to bring in, look at proposals and what people want to do, and then fund them, as it were. So for a nation like Nigeria, for example, you need to have very strong diagnostic system, very strong diagnostic infrastructure, and that costs a lot of money. For you to have a well-funded molecular laboratory, for example, is huge investment that is required. For you to have laboratories that will address the various aspects of the specialties in medicine, whether you're looking at neurology, the laboratory support for neurology, laboratory support for endocrinology, laboratory support for obstetrics and gynecology, okay, and then for even gastroenteritis specialties, there's laboratory component for all of this. So, and you need a lot of laboratory infrastructure to be able to support this.
So you can't generalize this because they are peculiar engagements, as the case may be.
Yes. So that's why we're saying that they need to increase. Maybe they don't know, and I don't know who is actually advising. Because one of the reasons, why people are going on medical tourism, it's not because Nigeria does not have the best of clinicians and specialist doctors. They are available. Okay, we have the best of doctors in cardiology, in gastro, in surgery, and all of that. But I tell you, what is majorly lacking is there is no laboratory infrastructure to support specialist care.
A lot to actually engage and talk about as we actually, have this conversation. But a lot of questions keep, popping into our mind. And let me just ask you one before we go on a break. 2023 is coming. In fact, most political parties have released their manifesto. They've talked about what they will focus on. But many of them have talked about, job creation, the economy, empowerment, security, human capital development, and many other things. But there is no basic focus on health. or probably it's been, injected into some of these titles, like I mentioned. But do you think you are satisfied with their manifesto and the way they talk about health sector as we prepare for 2023 elections?
Yes, I have read a few manifestos of some of the political parties, and I must tell you that it is still they will say a decorated donkey is still an axe. It's just like bringing out old documents and just beating them and cleaning them up and then putting them into circulation.
I'm tied to it with a new face.
You can't. You see manifestos that do not have health manifestos without depth, health manifestos without clear strategies for implementation. So you hear blanket statements like we're going to improve universal health coverage. Okay. Anybody can say that.
How do we do that?
How do we do that? How do we implement that? The National Health Insurance Act, Authority Act has been passed.
Yes.
Okay, and it's supposed to make health insurance compulsory. The sub-national governments, the local government, the states, are supposed to bring in counterpart funding, working with the national to be able to ensure that this is probably domesticated and implemented across board, which we have. Where is the political will and what are the strategies to ensuring that this happens? Because when this happens, you are going to be ameliorating, the health burden of the nation. That is one. You see blanket statements like we're going to improve life expectancy. How are you going to improve life expectancy? What are the strategies for improving life expectancy? Okay, anybody can come and say, oh, we improve life expectancy from what it is now. I think is either 40, okay, either 40 years or thereabout, to 80 or 90, like we have in advanced nations.
What are the measures that you put?
Measures. You don't have, for example, government making medical fitness test compulsory for citizens, which can be covered by health insurance to reduce out of pocket, or corporate organizations making it a mandatory either biannual or yearly activity for all their staff. Because what that will do is that you are able to pick and dictate very early, okay, ailments before they get complicated. So somebody has diabetes, hypertension, okay,
some cancer,
cancers could be easily picked. And most of these things, once you can pick them, you can manage them through. Okay, treatment and management protocol can be designed for the patient that will help him, do well, as it were. So we don't have that. So you see people presenting to the hospital and knowing that, for example, they are diabetic for the first time and presenting with blood sugar level of 20 millimole per liter, 30 millimole per liter. Okay, yeah, for the first time. So if we have health policies that makes medical testing compulsory yearly, and then we can see the health minister, the president, and his cabinet going for medical checkup using Nigerian hospitals, not going abroad, for baseline tests.
But I will tell you, they are spending their money. That is not the government's money, and they've been using this before they came into power.
Yes. So I tell you, we need to stop that.
How do we stop that? Now, that takes me to the question anyway. How do we stop that?
So, one way to stop that is to ensure that we fund the health sector. Is to ensure that what they are going outside the country to receive, okay, is made available here. I found it very ridiculous when I heard that one time our president went for to check up his teeth, okay, abroad.
Is it that he doesn't trust the dentists, that we have?
Yes, this doesn't need rocket science for you to do basic scaling and polishing or whatever, maybe dental intervention or treatment you will need.
It requires.
It requires, in country. And then you have people go for just very basic things outside the country. So let them fund the infrastructure. Okay, the health infrastructure. Let them fund it. We have hospitals. We have the healthcare team, quite knowledgeable healthcare team. Nigeria is so blessed. If you look at the curriculum for medicine. Our doctors do well anywhere they go to. The same thing if you look at the curriculum for medical laboratory science. We have one of the best training program across Africa. Okay, the best training program. So when our people, that's why our people are is more or less like plug and play when they get to any country in the world, because they are absorbed. Medical laboratory scientists are absorbed in UK, in Ireland, in US, without even asked to do any serious
examination or test,
you know. Okay, because our training is quite robust. So the point I'm trying to make is that we have very robust training program. What is needed is the infrastructure, automation. We need higher platforms, okay, to be able to work. We need newer technologies to be able to work. And these are things that basically are not needed, that are absent in
this country right now. All right, we'll do for a break. When we return, we still have this beautiful conversation. I have my guest in the studio with me, the National Publicity Secretary, Association of Medical Laboratory Scientists of Nigeria, Olusoji Billyrose. Thank you once again for joining us. After the break, we'll continue on the conversation. Stay with us. We're back.
Tell you for a fact that this election is between.
They sold form recently for 100 million. There's no meaningful development that can happen without peace, without us being united. Arrest all unregistered vehicles.
I think we have shown the depth and breadth of talent in our Conservative Party.
Because you want to prevent a situation whereby that powdering substance will be flushed immediately.
Tell you for a fact that this election is between.
They sold form recently for 100 million. There's no meaningful development that can happen without peace, without us being united. Arrest all unregistered vehicles.
I think we have shown the depth and breadth of talent in our Conservative Party.
Because you want to prevent a situation whereby that powdering substance will be flushed immediately.
Tell you for a fact that this election is between.
They sold form recently for 100 million.
Thank you so much for still sticking around with us. It's the Straight Up program right here on Bright Television, the of talk and entertainment. And we're looking at the health sector as we prepare for the 2023 elections. Many manifestos, many political parties, many politicians and candidates are coming out to give us their plan towards the 2023 election. How ready are they and what are expectations? And to do justice to that is also a veteran and a concerned Nigerian, the National Publicity Secretary, Association of Medical Laboratory Scientists of Nigeria, Olusoji Billyrose. Thank you once again for joining us on the program.
Thank you, Ayo.
All right, let's look at some other beautiful things. Now, we've talked about the challenges that the sector is facing, the health sector is facing, poor funding, no infrastructures, medical conditions are poor, as the case may be. But the little ones we have we been able to use it well? What are the quality or the quality standards that we have? Let's take your own sector, for example, now, the laboratory scientists. Now, have we been able to maintain good or high quality standard in that particular sector?
Excellent. I want to admit that we're not where we're supposed to be. Okay. Of course, the regulatory body, the Medical Lab Science Council of Nigeria, is doing quite a lot with respect to its oversight function on either private laboratories especially and public laboratories. But the support that is needed is not largely there. Okay, the support is not largely there. For instance, you get a lot of private laboratories, for example, owned by doctors or hospitals, where you have laboratories that will not even allow regulators to come and look at what they are doing. For example, just because they will probably tell you that, oh, they are being regulated by Medical and Dental Council of Nigeria. This is a hospital, but it's a hospital that has a laboratory, and they will not allow you enter in there.
Medical Laboratory Science Council of Nigeria.
Excellent.
Association.
Yes.
And many other.
Yes. So I'm just trying to mention a few constraints, but I can give it to the Medical Lab Science Council of Nigeria. When it comes to mentorship, it has been very robust for private laboratories especially. Currently, we have about 11 to 12 laboratories that are ISO 15189 accredited in Nigeria. Of course, it's a far cry when you look at what South Africa is doing, what Kenya is doing, okay? In South Africa, you have over, I think, about 200 laboratories that are ISO accredited.
We have 15 in Nigeria.
About 12, okay, 11, yes, only. Because over the years, there haven't been support for this. But more labs, as they see other laboratories, being accredited, more labs are beginning to key into this. Now, apart from the ISO standard and checklist that is being used, we also have the minimum benchmark requirement that is expected for you to be able to practice as a laboratory. Okay, and most of the laboratories are able to fulfill those minimum benchmarks, but we need to clean up. You will agree with me that having about 11 to 12 laboratories that are ISO accredited for a nation of about 200 million people is a far cry. Okay, so a lot more need to be done. More laboratories need to be encouraged to key into the ISO accreditation program by the Medical Lab Science Council. The Medical Lab Science Council, as we speak now, has been admitted as one of the members of ILAC, International Laboratory Accreditation Committee body. Okay, so any lab that is accredited in Nigeria, any result from such labs will be recognized across the
globally
world.
now.
Globally.
Okay.
You can take a lab result to Canada, to Ireland, and they won't necessarily ask you to do a repeat. They will accept it and use it for treatment.
So do you think awareness is the problem, or what exactly is the challenge? If we have such robust and of course a strong body in Nigeria, how is it so difficult to have this done?
Yes, so we need the political commitment and support from government. Government needs to support and of course encourage more laboratories to key into it. And of course, there is a lot of incentive for having accreditation, either for commerce or for the general good of the nation. Okay, so it's very, very important that this thing is done. So more laboratories need to key into the accreditation program of the Medical Lab Science Council. The government hospitals as well need to key into this program, because there's virtually, I think, except one government hospital that was accredited for ISO. We don't have, and we have close to more than 60 federal medical centers and teaching hospitals and specialists across the country. Just this is for the federal government. We're not talking about state-owned hospitals, tertiary hospitals, secondary healthcare facilities, and all of that. They need to be encouraged, because who benefit from a well-accredited and regulated system? The citizens. Okay, so we need to see all laboratories, keying into quality management system, because this is the only thing that can bring a turnaround and improve confidence in laboratory results and outcome. That is one. Then number two, the hospitals. The act establishing the Medical and Dental Council of Nigeria only empowers it to regulate the practitioner, not necessarily the practice. So you don't find the Medical and Dental Council of Nigeria going to inspect hospitals and administering a checklist to see that this is the minimum requirement that is expected for you to be able to practice, and then probably grade hospitals into different stars, 1 star, 2 star, 3 star,
that's the case from there.
because that will also improve confidence. If I say this is and then maybe great hospitals as well based on specialization and area of core competencies. So we don't have that, but we need to do that. The law is being is at the National Assembly for amendment. These are the things I feel that should be put into that law to enable the Medical and Dental Council to be able to regulate facilities, hospitals, clinics, and all of that.
To maintain the standard.
Yes, to be able to enable us to maintain standard. Most of the hospitals that we go to in India, and probably Dubai, Turkey, they have standards.
Yes.
They are well regulated. But you get to some hospitals here, is a far cry. You cannot even determine the level of decay that is in some of the practice. You enter the environment, the ambience is horrible, and then the infrastructure is also horrible. So there must be that deliberate effort to be able to do that. So these are the concerns that I believe that the Medical and Dental Council also can put in place, rather than just trying to perhaps extend territory to what people are already doing. You can consolidate
on what we have,
on what we have, on what we are doing, and let's all be more deliberate. The Medical Lab Science Council, do more regulatory function, oversight on the lab, and clean up properly, because we need the best of healthcare for Nigerians. The same thing, the Medical and Dental Council should clean up the hospitals. The Pharmaceutical Council of Nigeria should clean up the pharmaceutical outlets across the country. So we have the best of pharmacy services, the best of clinical services, and the best of laboratory services that we can get for our nation. Because at the end of the day, who benefit from a well-regulated facility? Who benefit from a well-regulated lab or hospital or pharmacy? Is the citizens. And the citizens is me and you.
That's true.
You have better confidence. You can enter into lab A and you're sure that the result you're going to get is the same as you get in lab B. You can enter into hospital A and you're not afraid that, am I sure that my pregnant wife will be able to deliver here?
Effectively,
all the complement of staff needed to provide that service, are they available? Or we're just improvising with whatever is available, with all kinds of, you hear auxiliary this, auxiliary that, instead of admitting qualified nurses, you hear people admitting auxiliary nurses, people who do not have conventional training. Somebody just train them into having 1 or 2 skills, and then they are the core people. They are even called metros managing. And then where you need a clinician, you have probably a CHU. In those places. Of course, the CHUs also have their relevance at primary healthcare center level and all of that. But we need to be able to put round pegs in round holes. And this comes with ensuring that the well-trained professional is allowed to practice.
Well, indeed, we've talked about a lot of things, especially policy making now, as regards the national labs that we have in our country, Nigeria. But my question, as a wind down on the program, is that some experts have said that, high-tech labs in Nigeria could be the game changer in the system, and of course in tracking lots of challenges that we have in our country, Nigeria. Do we have that? What's your take on that? And how long will it take us to have a very strong high-tech labs in our country, Nigeria?
Interestingly, we are beginning to we have a few high-tech laboratories now. People are stepping up the game. The era of having blue curtain labs are going to be over in no distance time, because we are beginning to have huge investment in the lab. Maybe thanks to also COVID. During COVID, the private sector was allowed to do quite a lot. And that empowered them to be able to bring more high-tech infrastructure into their facility. So I tell you that if you enter some of those laboratories now that have been accredited, or even those that are not accredited, most of the big labs, they are doing quite a lot. unlike the regular malaria, typhoid that you find, they are doing quite a lot. Okay, I can't be mentioning names because I'm on television.
Definitely.
But definitely a lot of labs are upping their games. We're having investment in molecular biology. Okay, we're having investment in immunohistochemistry. That's an advanced level of diagnosis and typing for cancer.
Okay.
We're having a lot of investment when it comes to autoimmune diagnosis, disease diagnosis. We're having a lot of investment when it comes to, you know, even DNA micro specializations, as it were.
Okay.
So a lot is actually coming in, I must tell you. And the other labs are also trying to up their game. But this is still a far cry when you look at the fact that we are dealing with over 200 million Nigerians. You understand? So it's a far cry. What we have is a far cry. But with more commitment, the medical laboratory scientist is able to do quite a lot, because the knowledge is there, the technical dexterity to be able to do the job is there. We need support. We need more autonomy. We need government support. We need management support from the hospital to be able to implement quality management system in the laboratories. Because at the end of the day, even the head of the laboratory, I mean the head of the hospitals, the CMD, the CMA, and the government official are going to use that same hospital. You don't know when somebody will be brought in, you know, with
Family, if you're a family member, yourself.
for family members, you know, with for emergencies, and then you will need to rely on the same hospitals that you didn't fund. So I will say, may it not get to that level, but funding the hospital, funding the laboratory is actually something patriotic that we should do, because at the end of the day, every one of us is going to fall back on these centers.
Indeed, everyone will definitely benefit from one these centers, as the case may be. Well, lastly, as we go, I know my producer is telling me time up, but as we go, it's like we've neglected the, you know, laboratories that we have in our secondary schools. Back those days, I remember that every time as a scientist or a science student, you always get to the lab and try to, you know, put your hand into one or two things. If you go around schools today, there are no labs again. Your association, are you advocating for this, and what are the measures that you're putting in place to see how to revive our schools back?
Actually, when you look at interest in science is dwindling. The arts, you know, it seems to be taken up, because that is where the paparazzi is,
and the money is.
and the money is. You don't find, just look at even the entertainment industry. Everybody wants to be a musician. Everybody wants to be to participate in Big Brother Africa and all
whatever, all those reality names,
all the realities there, because that is where the fame is and all that. And then, you know, when you stay in the lab, you do so much experiments, you do quite a number of things, and you're just behind the scene. Nobody particularly see you. Nobody, there is no immediate gratification, as it were. So, you know, the motivation for doing science, of course, is dwindling, as it were. But government must, I'm sure, well, government knows that the bedrock of any nation is science. Okay, is it science? Whatever you are going to do at the end of the day, if we are going to get industrialized, if we are going to advance our medicine and medical sciences, our laboratory sciences, pharmaceutical sciences, of course, we must not neglect the bedrock, which is those secondary school sciences. You know, so as an association, we have done a lot of advocacies to schools to try to say, oh, science is good, science is interesting. Okay, science is actually life, because you can interpret life, you know, life.
Science is everything, right?
Yes. So we encourage people, and of course government as well, to fund the laboratory. The laboratories, actually, you go to those places, you don't find much there. And when people are not well grounded, you know, there is a disconnect and a dislocation. They are unable to grab
to measure, to complete.
When they now begin to have bigger baptism of science at higher levels. You know, and all that.
Bigger exposure of science at high levels. Thank you so much. Well, I've been having this conversation with the National Publicity Secretary, Association of Medical Laboratory Scientists of Nigeria, Olusoji Billyrose. Thank you once again for joining us on the program.
Thank you.
I know you have one of the best high-tech labs. Maybe when the time comes out, you will let us know how to pronounce and push it out for the world to see. Once again, thank you so much for being part of the program.
Yeah, thank you.
All right, that's the package on today's edition of Straight Talk right here on Bright Television, home of talk and entertainment. It's our duty to let you know that, yes, our country is the first. And like I always tell you, when you play your part, I play my part. We have a better place called the Federal Republic of Nigeria. On behalf of everyone who's been behind the scene, Larry Jemmy, yes, so thank you so much. My name is AYOBAMI. ADEYEMO. God bless you, and God bless the Federal Republic of Nigeria. Goodbye.
Tell you for a fact that this election is between.
They sold form recently for 100 million. There's no meaningful development that can happen without peace, without us being united.
Arrest all unregistered vehicles.
I think we have shown the depth and breadth of talent in our Conservative Party.
Because you want to prevent a situation whereby that powdering substance will be flushed immediately.